So we have an artificial Christmas tree, and it usually goes up in the attic every, just after, usually around the first. But for some reason, my wife said, okay, can we get it? Can we get the tree up? And it was December 26th. John, I got to tell you, as I was putting the tree up, I took a spill on the ladder, and the tree was up safely, but I wound up on my back. There's no permanent damage or anything else like that, but I did feel some back pain, and I needed something to subside the pain. And I asked my wife, I said, and this is a shameless plug, but this is actually true. She used the Salon Pass pain relieving jet spray, which was very helpful. So when the opportunity came up this week, when I was speaking with the PR team, I was so excited to be able to have the opportunity to get you on. But John, you're very busy. You're CEO. You're president.
Hisamitsu. It's a Japanese company, so
Hisamitsu America. So I want to say thanks for taking a few minutes. I got a couple of questions for you because I know you're tight for time. Tell me about the origins of Hisamitsu Pharmaceuticals.
Okay. Well, Ted, first of all, thank you for sharing your story. Wintertime, the way you hurt your back, a little bit unusual, but we get a lot of similar things where people are getting hurt and muscle pains from shoveling driveways and the like. Fortunately, for a lot of folks, it hasn't been a crazy winter weather-wise, but if anybody runs into a problem, we're certainly there as we were for you. Hisamitsu America, actually, Hisamitsu Pharmaceutical Company is our parent company based in Japan, founded in 1847. They're a publicly traded company, do about $1.5 billion in sales. Our primary brand, marketed in some 70 countries around the world, is a brand called Salon Pass. And that brand was launched in Japan in 1934, brought to the United States in 1989. Our company really has one mission. We're very singularly focused, and that's to improve the quality of life for pain sufferers through patch. We call this salonopathy. I don't know, Ted, if your listeners ever wondered how medicine was administered back in the early 1800s, but the CEO of our company, I'm talking our parent company in Japan now, built a public medical museum in Tosu, Japan. And the museum actually walks you through the history of the development of medicine and the administration of medicine. And way back in the early 1800s, at least in Japan, medicine was carried in backpacks by the precursor to pharmacists, who literally went from town to town and administered the medicine right there on the spot, compounding it, developing poultices, which are actually a precursor to what we call patches today.
Excellent, John. I got to tell you, it's an easy question for me, but the question I have from some of our listeners, why should consumers choose Salon Pass?
I think that comes down to three things that I kind of think would be important to consumers. First is the quality of what they're buying. The second is the value of what they're buying, and the third is really what's the mission of the company and how reliable are they in delivering that mission. The quality of our products, scientifically speaking, now are world renowned. I myself have fielded phone calls from European pharmaceutical companies that are interested in getting in touch with our R&D team in Japan, because we're basically known as the world's leaders in hydrogel patch technology. And it's not just that technology. It's over the course of 170 years of marketing and manufacturing patches, you learn that even little things can mean a lot to consumers. I mean, a couple of quick examples are, latex is something people are allergic to. So you want to avoid, where you can, having latex in the patches. Things like having rounded corners on patches. Believe it or not, there's a difference in the rate of peeling when you have a patch that has square corners versus a patch that has rounded corners. So from a lot of experience and I think we've really developed and have a reputation for being really the quality manufacturer of patch technology. From a vantage point, and by the way, one other point that maybe your listeners might be interested in is the Japanese have developed a business concept, and I know it's taught in a number of business schools in the United States. It's this concept of Kaizen, which basically means continuous improvement. And I know our company is routinely updating our products. Right now, we're in the process of replacing best-selling patch item in the United States with a new and improved version. That's because of our focus on salonopathy, which again is to give the consumer the best possible pain management experience we can. From a value standpoint, because that was really the second reason I think folks may want to choose our brand, we do have a range of products, but at the end I would call a very good product. You really get a great value there. You can basically, the patch at retail is going to be about 18 cents. And I think when you compare that with, let's say, a couple of Advil in a 24 count bottle, that cost compares very, very favorably. At the other end, we do have some very premium technologies that have different formulations, different size patches, and different patch materials, and they can retail upwards of $1 to $1.20 a patch. And I guess finally, I would reiterate the fact that our mission is really singular focused. It's that idea of salonopathy, which is to improve the quality of life for people in pain through patch.
John, thank you so much for that thorough answer. I guess my next question is, and I'll start off with a statement. Pain relief patches are not new, because I've heard of Tiger Balm and Icy Hot and Bengay. I mean, you have all these different brands and competitors out there. But how is Salonpas the only FDA patch that's currently out there?
Yeah, Ted, I actually get this question a lot. And most Americans, I think, are unaware that the United States is one of the only countries that does not pre-approve every drug. In the early 1970s, the Food and Drug Administration published drug monographs, OTC drug monographs. And this was an attempt to not have to review everything and to distill it to, let's consider a monograph a cookbook. So the monographs contain the recipe for different OTC drugs, and it prescribes the exact labeling you need on the box, the dose of the product, the active pharmaceutical ingredient, and the levels that are going to be in that product. You and I, Ted, could go to business tomorrow making our own version of Tylenol if we found a current good manufacturing manufacturing facility, a CGMP facility. As long as our product conformed to that monograph and we labeled it as such, we could go to business tomorrow and we don't have to have the FDA approve our product because we stayed within the monograph. The reason Salonpas is the first FDA approved topical NSAID OTC, that's because there's another pathway. Most people don't use that pathway because it's a lot of time and expense, and that's the FDA's new drug application process. We worked for 7 years to get FDA approval, and finally in 2008 we did. So we are, in fact, the first topical NSAID approved OTC. Why would we do that? And just to give you a feel for cost, the filing fee for an NDA is currently $1.2 million. And when you pay that fee, that's a user fee. That's so that the employees of the FDA, their cost for reviewing your data is covered. And that gets reviewed by Congress every few years, and the cost keeps going up. So we paid a user fee of $1.2 million on top of all the clinical work we did. And when you pay a user fee, you get a 10-month review. That doesn't guarantee you're going to be approved. You just get feedback. And ultimately, as I say, in 2008, we came on the market. But when you do an NDA, you're operating outside that cookbook, outside that monograph. And what that gave us was two unique claims within the entire category. One is the fact that we were able to clinically support that our product works up to 12 hours. So there is a duration claim benefit there for consumers. The second, and maybe more important, every OTC pain drug in the U.S., and I'm talking including systemic drugs, Advil, Aleve, Tylenol, they are all indicated to treat only minor or mild pain. We're the only product, because we did clinical studies in tough or moderate pain, that when you look at the drug facts on the back of our box, we're the only product indicated to treat both mild as well as tougher moderate pain. So we did all the clinical work. We paid the filing fee. It took us 7 years, but this is why we're different than what you find in the rest of the marketplace.
John, as thorough as can be. I mean, I have a huge smile on my face right now because, I mean, oh my goodness, excellent. So I want to let the folks know that we're speaking with John Incledon, the president and CEO of, hang on one second. And excuse me one second, I lost my train of thought. The makers of the Salonpas relief product. John, there's a great blog that's on your website, and it talks about consumers overuse over-the-counter pain pills and, you know, the alternate topical treatment that's overlooked. And you really went into that in your last answer. But the question I have for you is, so, you know, nowadays people are concerned, everyone's an educated consumer about what they're putting into their bodies. And one question I have to ask you, does Salonpas contain any type of steroids?
I can tell you, Ted, I'm pleased to tell you that in fact we do not contain any steroids whatsoever.
Perfect. Like I said, I know you are short for time, but one question I had to ask you, well, two final questions. One that's off the topic is, so we had Super Bowl 50 this past Sunday. You had kind of new school and old school with Peyton Manning and Cam Newton. I wanted to know, which team were you rooting for, or are you not a fan of either team?
Well, you know, I heard your opening where you were talking about the fact you're going to talk about the relocation, I guess, of San Diego and Oakland, or the potential for that. You know, I've been a long-suffering St. Louis Ram fan. I mean, I followed them when they were in Los Angeles. So I wasn't particularly fond of either, or I didn't really have a favorite in that Super Bowl. However, what I would say is that, you know, just like you hear some of the voters in the primary saying that they're kind of tiring of names like Bush and Clinton, I was kind of tiring of the Manning name. You know, he's been around, he's been in the media, you know. So I was looking maybe for a fresh team to come in and win maybe their first Super Bowl and generate some excitement that way. So if I was leaning anyway, it was towards the Panthers. And I guess as an added reason, I've got a son that's Wake Forest University in Winston-Salem, which is, of course, is in North Carolina.
Of course, of course. Well, like I said, the one good thing about the Panthers, yes, they lost the game, and I'm going to go into it later in segment 3. They're going to be around for a very long time because they appear to have a pretty young nucleus. So I expect them to be up there challenging in the next, 3 or 4 years. Another question, easy question for you, as we get ready to close you out. Where can we find Salonpas?
Well, we've got pretty good distribution in your food and drug retailers across the country. We're in mass retailers like Walmart. You can even find us in Costco and also Dollar General and Family Dollar. So we're in a lot of outlets, and I guess I would close out, first by saying thank you so much, Ted, for taking the time to speak with me. But also for anybody that's out there in pain, consider some of the things we talked about. Some of the risks, if you're using a lot of pain pills, it's not a zero-sum game. I don't have to take only pills or only patches. Good medicine and good pain management may involve using both products in a therapeutic form, both for your safety but also for your relief.
John, we give you a round of applause.